will be posted on our website. Sorry, I got distracted there. We also have a questionnaire that is downloaded to the presentation already, but we also will be emailing it to everybody. Now, this is a questionnaire related around positive parenting and practices in your area that we would like to incorporate that knowledge into the overall project that we're working on all year around this. So if you could fill that out and return it to us, that would be great. I'm going to stop now and turn this over to Jenny Gray. And if you'll hold just a moment. Okay. All right, Jenny, you are unmuted, and if you'll click on the Show Your Screen button, it should show your computer screen. Ah, there we go. Thank you, and I'll let you take over.
Good morning, good afternoon, good evening, depending on where you happen to be in the globe. I'm speaking to you from London, England, where it's currently 2 o'clock in the afternoon on a rather chilly day. The only good thing is that our daffodils are all out and looking very cheerful, so that's the positive bit for me in terms of looking out my office window. I want to welcome you all very much to our second webinar in this series to do with the Global Institute continuation around positive parenting. Joan van Niekerk, our president, when she comes on to do her session, will speak a little bit about the work and how it links as part of an ongoing project over the 2-year period leading up to our International Congress in Calgary, where we want to focus on positive parenting, hence our encouragement and plea really for you to complete the questionnaires and to engage in events at our forthcoming conferences in Toluca, Mexico, Bucharest, Romania, and in Kuala Lumpur, Malaysia. We are very keen to ensure that everyone participates and we learn as much as possible about this very important topic. Today I'm going to speak specifically around supporting positive parenting through legislation and policy. The time only allows a sort of snapshot, so there will be a number of other areas where I've not covered, and really we are very keen that you include these in your responses to ISPACAN. My name is Jenny Gray, as you can see from the screen. I'm the immediate past president of ISPACAN, having handed over to Joan in September last year at the Nagoya Congress. I also work as a social work consultant, and in a previous life spent 20 years developing policy at the government in the UK. I want to just start by introducing you to our founder, Dr. Henry Kemp. He was a visionary pediatrician who left Nazi Germany as a refugee and came to work in Denver. There he set up his multidisciplinary teams and also founded ISPACAN in 1977. So we're very honoured that our current offices are in the Kemp Centre in Denver and that we've kept the association with him. At a congress that was held by ISPACAN in London in 1978, Kemp himself spoke, and I know was instrumental in starting the British Association of Child Protection and Neglect. And he talked about how in a society we start off by initially denying that physical abuse exists. It's only those people who are perhaps the most crazy or drunk or drugged who are responsible, gradually recognizing abuse. Battered Child Syndrome, his seminal paper came out, as you may recall, in 1962, moving through to better recognition of physical abuse and better management of it, along with neglect and failure to thrive, and then, importantly, recognizing emotional abuse deprivation, neglect and scapegoating, through to the recognition of sexually abused children, till we reach the last stage of guaranteeing each child is wanted, loved, cared for, sheltered, fed, receives first-class preventative, curative and health care. And I think it's this last stage that we are all striving to, although I'm sure you would agree with me in terms of one's experience that we do rather move backwards and forwards through these stages, at times feeling we've made more progress and then at other times feeling we've gone backwards, but all the time wanting to focus on how we can ensure the best for each child in every society within the world. And it is our particular focus in terms of our positive parenting. It really looks at how we can support parents in their important role and ultimately do what's best for children in our society. So I'm going to talk about some components of what it takes to prevent maltreatment. As I said, this is not a comprehensive list, but based on some key areas where I think we need to look at addressing, particularly from the perspective of policy and legislation. There has been a lot of work done across Europe, and in particular the Council of Europe has taken a lead in this. In 2006, they developed a recommendation on positive parenting, and it took this definition: parental behaviour ensuring the fulfilment of the best interests of the child that is nurturing, empowering, non-violent, and provides recognition and guidance which involves the setting of boundaries to enable the full development of the child. So a key question, this is obviously a definition derived from European countries, is it understood across our societies? Does it understood by parents, professionals and governments? And depending on what culture or country you come from, is it a definition that holds up, or are there other definitions that you might be working to within your context? And again, this is something we'd really like to hear from people who are completing the questionnaire. The statement and documents that accompany it are underpinned by the following principles: that parents should provide their children with nurture, responding to a child's need for love, warmth and security; that they should be provided with structure and guidance; that the child has a sense of its security, a predictable routine and necessary boundaries. Very important that children are recognised, listened to in their own right and valued as persons. So critical is that children are empowered to enhance their own sense of competence and personal control. And in addition, that they are the subject of a non-violent upbringing, which means that all corporal or psychologically demeaning punishment is excluded. So what does this mean for parents? Essentially that children, their children, our children will do best when parents are supportive and warm, spend quality time with them, try to understand their life experiences and behaviour, explain the rules they are to follow, praise good behaviour and react to misbehaviour with explanation and, if needed, non-violent punishment such as time-out, repairing damage, less pocket money and so forth, rather than with harsh punishment. And you'll see as we move through some of the interventions that are used that in a sense those principles underpin the different models and types of intervention that are found to be effective. Council of Europe was also clear in stating that parents need to have access to resources to support them, to remove barriers to positive parenting, and that positive parenting should be promoted through the actions of awareness raising. And certainly their website has a lot of very helpful resources if you'd like to turn to that. Turning now to the international picture, all but 2 countries are bound by the UNCRC, And I always think that this is the glue that binds us all together, despite any differences linguistically, culturally, in terms of our religion, our own belief systems. Article 19 is clear that children have the right to protection from harm and the right to family life. In addition, important that parents are able to provide appropriate guidance and direction in a non-violent manner, to provide materially for the child, and to enable the child to be heard, with an emphasis on parental nurturing, providing structure, recognition and being empowered, and a shift in emphasis from parental authority to parental responsibility. The UNCRC places obligations on the states to act as guarantors, enablers and promoters of children's rights and mechanisms for supporting parents. Sets out that the role of state parties is to develop a policy on parenting, support parents in rearing their children, and has policies which include creating the conditions for positive parenting, removing barriers, promoting positive parenting, and providing equal access to resources. There are some examples that I've set out here where national legislation has been used to support positive parenting by banning all forms of physical chastisement, and as at the end of last year, some 43 countries had done this fully. Ensuring women have equal opportunities in the workplace, ensuring all legislation is family friendly, and creating research, evaluation and project development bodies that will both develop projects to support positive parenting, but also evaluate whether their legislation, policies and projects are achieving their aims in this respect. I have a particular example from England where our Children Act 2004 places a responsibility on our local authorities, and we have 152 in England, to work together with other key public services such as health, education, the police, and NGOs at both national and local levels to improve the well-being of children in their local authority area. This is a duty placed on local authorities to work collaboratively with others. Our key legislation in relation to safeguarding and promoting the welfare of children is the Children Act 1989, which also incorporates the UNCRC, and it enshrines the principle that it's in children's best interests to be brought up in their families wherever possible, and whilst parents have a responsibility to bring up their children, they may need assistance from time to time to do so, and that parents should be able to call on services from or within the help of, in the context of the local authority and the statutory guidance, the local authority when they are required. So it both sets out mechanisms for protecting children from harm, but also responsibilities on state agencies and their representatives to support parents. We need to have both national and local policies which support parenting and families, enable all children to form secure attachments to their parents and caregivers, have access to good quality childcare provision, are able to access knowledge of how to bring up children in non-violent ways and maximise their developmental potential, are able to access help with parenting concerns, particularly, for example, through helplines, which are found to be very effective, providing advice and counselling services, parent education classes and self-help groups, and that in addition to these more low-key services that should be available for all parents, that those who need it receive specialist help. A recent article that was in our ISPCAN International Journal for Child Abuse and Neglect was looking at what research tells us about whether our policies in fact support the prevention of child maltreatment. They pointed out that there's not a lot of evidence of this work being undertaken. Certainly in the UK we have got a good track record of commissioning research to see if legislation and policies are working, but can be quite difficult, I think, to isolate one particular policy has been directly responsible, for example, for preventing maltreatment, when it in itself is difficult to quantify. However, Clevens et al., in looking at public policies within the states, found that of the 11 policies they, this is spelling mistake there, I see, policies they selected, 2 were significantly associated with decreased maltreatment rates. The lack of waiting list access subsidised childcare, and policies that facilitate access to health care on a continuous basis. It's very interesting that these 2 areas are ones that both support parents to care for their children and also minimise stress, because for those of you who are parents or look after children, having access to childcare and making sure your children can access good quality health care are critical to you feeling you're doing your best for your children. It also links back to Kemp's 6th stage, of where children are well looked after and receive good quality health care. Now, a particularly important issue in being able to implement even the most effective, well thought through, well evidence-based legislation and policy is having sufficient resources available. It's interesting that as you travel around the world there is agreement, I think, whether one's in a high, middle or low income country, that there are not enough resources in our area, child abuse and neglect, and in particular in its prevention. There are key issues about whether the provision of services, and particularly those to support parents and positive parenting, are part of a plan that's made at both central and local government level, and whether there is funding available to do this. If it's sufficient, and whether the funding is ring-fenced, because funding, as we know, can be used inappropriately, for example, to build rather grandiose public buildings, rather than in fact being used to support parents. We also need to have trained staff, both volunteers and professionals, who are able to support parents in their everyday activities, to help them learn how to respond positively to their children, and also that they, if they're implementing evidence-based programs, implement those that are known to have the best quality evidence, and that they have resources available to them to do so, and importantly that these programs are acceptable and accessible for parents depending on their own contexts. There's a particular diagram I use a lot when I'm presenting. It's one of my favourites, designed by Macmillan and colleagues, which looks at a schema for how we can use universal and targeted services to prevent maltreatment, and then specific specialist or targeted services to prevent its recurrence and the impact of abuse or neglect on children's health and development. I'm going to now give some examples of evidence-based interventions at the 3 levels of primary, secondary and tertiary, in keeping with the public health approach to prevention that ISPACAN is following, along with other organisations and with WHO. This is not an exhaustive list. There will be some areas that I've selected and others that I haven't. That doesn't mean the others aren't important, and would very much urge you to, as I said, complete the questionnaire and let us know what you use, and in particular if you've got a particular program that's developed in one country, how it's been able to transfer across to your own context. Looking at legislation, the first country to ban physical punishment through legislation was Sweden, and this was evaluated 15 years later by Durant. She found that there was public support for such punishment had declined, that only 1/3 of middle school children reported physical abuse from, physical punishment from a mother or father, and that was of the most mild forms. That 3% of the population had received a hard slap, and 1% had been hit with an object. Young children were less likely to be young people were less likely to be suspected of physical abuse, and that no child had died as a result of physical abuse. This also links with research that's been done more recently, and the importance of having legislation which can be supported by other materials, but very critical that the legislation is in place. Looking at secondary prevention, in England, Davis and Ward undertook an overview of research studies. They found that the most effective targeted approaches to preventing physical abuse and neglect appeared to be home visiting programs and multi-component interventions used in parent training. Two examples of home visiting programs which are targeted at children identifying being at greatest risk of maltreatment relate to work that was done by David Olds in the States and has been taken forward within the UK context under the umbrella of the Family Nurse Partnership. In the UK, home visiting is done by nurses who visit low-income first-time mothers starting antenatally, with a particular focus on improving parenting skills. In the States, a long-term follow-up that was done by Olds after 15 years found that child abuse was identified significantly less so often in home-visited families except where there was moderate to high levels of intimate partner violence. And I think home visiting is something that's being used quite extensively in different places around the world. Two specific parenting programs here, I mentioned Triple P and also Incredible Years programs, which have been shown to reduce harsh parenting and increase positive discipline and nurturing parenting. They have been well evaluated, and I've given you the references if you want to follow up there. Other programs which look more specifically at tertiary prevention, Parents Under Pressure, which focuses on parents specifically who've got substance misusing problems. This was developed in Australia and has been piloted currently by Jane Barlow and colleagues in a local authority within England. It's found to be successful in treating substance misusing mothers in the US, and we're using it with a younger population here in England, but also getting very good results. In terms of looking at the interactions between parents and children, interaction guidance, which draws on using video feedback, it's also been found to be, sorry, I've gone on too far there. Let me just get that back. It's found to be effective, along with parent-child interaction therapy, which uses direct coaching and practicing skills in parent-child interactions. For those more complex situations, abuse or neglect, multisystemic therapy has been found to be helpful, particularly in physical abuse and neglect. It involves evidence-based interventions to address both parents' and children's needs. And then for those children who are in the care system, multidimensional treatment foster care has found to be very effective in relation to children placed away from home, where work is done with them, the foster parents, birth and adoptive parents. US evaluation has shown positive outcomes in terms of increased stability of foster placements, child attachment and cortisol levels. So they're just some of the interventions that are found to be helpful, looking at universal, targeted and specialist areas. Sorry, just going backwards instead of forwards here. I wanted to speak very briefly about a framework that's used for assessing children's needs within the UK. It's been implemented since 2000 by the UK government and is for use by all professionals and agencies. Essentially, it was underpinned by child development knowledge, as well as that in the areas of how to support parents and the family and environmental factors that impact on children's developmental needs. So the assessments are expected to be undertaken in each of these areas, but importantly we then need to go on to think about how to develop effective interventions based on our knowledge from a good quality assessment of the child and family. Within the government here, the Department for Education has commissioned child and family training, and I've been doing some work with colleagues from child and family training and other organisations to produce evidence-based materials to support practitioners working effectively with children and families. And they're particularly designed to address the challenge of how to train large numbers of staff in evidence-based interventions, and a recognition that not everybody can be trained in very specialist evidence-based models. So the project is set out to design resources for use with practitioners across the whole range of different disciplines. They work with children and families, and to be able to intervene specifically where there are concerns about abuse or neglect. I've just given you there a reference to the article, the research which underpins the work that's gone on, that was undertaken by Benjamin and Elliott, who looked at all the different evidence-based programs and came up with the common elements of effective interventions to prevent maltreatment and its recurrence. And it's these findings that have been used to develop the resources to help practitioners, and in particular there's one guide on promoting positive parenting. And this guide, drawing on the research findings, focuses on providing exercise and materials to help practitioners to work with parents in enabling them to give praise and encouragement for behaviours that they want to encourage and active ignoring of behaviours that you don't want to encourage. And one of the nice examples there is whining, which I have a particular thing about, because whining is very irritating as a parent in my experience. And also, importantly, about giving effective instructions, shaping and managing children's behaviour, and dealing with challenging behaviour through the use of clear boundary setting, non-punitive limit setting, including timeout and privilege removal. We have other resources that are available on the ISPCAN website, specifically looking at issues around prevention of corporal punishment, as well as promoting positive parenting, and I would encourage you to visit that resource. And at the end of the paper there are a number of references that I won't go through, but I've included them here in order that people can follow up on the different programs and look at them in detail, because obviously I've only been able to do a very quick skim through. Now before I finish, someone's asked if I can go back to the pyramid, which I presume they mean what we refer to as a triangle, so I'll do that. If you could just let me know what it is you'd like me to talk about, but essentially this framework provides areas in which children's developmental needs, the parents' capacity to be able to meet those needs, and family and environmental factors that impact on parenting capacity and children's developmental needs have to be assessed. It's obviously important to look at this from the child's perspective, and in the context of the Children Act 1989, focus on what actions, what interventions need to happen in order to safeguard and promote children's welfare. So if someone else wants any further information about that post the presentation, I'd be very happy to speak some more, or if there are particular questions that you would like me to speak to, please raise those in the course of the presentation. And I'd just like to thank you very much for listening, and really encourage you again to fill in the questionnaires and particularly to tell us what it is you're doing in your area, because we want to end up with a very good quality document that pulls together the best of what everybody is doing, what's found to be effective, what's perhaps not worked and why it hasn't worked, how we can do things differently so that we can support positive parenting in very different contexts where perhaps attitudes to parenting may differ greatly, and think about how we can do this in a way that truly ensures our children are safe and that actions are taken in their best interests. So thank you very much.
Thank you very much, Jenny. Appreciate that.
Thank you very much, Jenny. Appreciate that.
We're having a little problem getting Joan on. And I am echoing. Oh, there we go. If you give us just a second, we are working to get Joan on the line and Rajiv. I know that they're trying to connect, so it'll be just a moment before we're able to continue. The PowerPoint presentation will be on the website. Nikki has just posted the link. So anyway, I really do apologize. I am not sure why they are not linking in to our system here, because they should be, and we are just having problems. The web, someone has asked where they'll find the questionnaire. It will be emailed to everyone, but it should also be, maybe, is it attached? Oh, only the concept paper is attached. We will be emailing it to everyone, but it will also be on the website, so you'll be able to get it there as well. If you give us just a moment, I'm going to put everyone on hold, so you'll have a muted, you'll hear nothing for a minute, just while we try to get them online. All right. Jenny, we do have a question for you, and also I'm wondering whether you could do a little bit starting with Joan's presentation if we can't get her online. So I'm going to see if I can, and let's see. Just a moment. Okay, we're getting feedback noise from Joan, and that's been a problem. We had the same problem. It's with her internet there. So, Jenny, you are currently the presenter. I'm going to unmute yours again, but I'm going to show my screen. Oh, I can't show my screen. Jenny, could you give just a little bit of background about oh, now I've lost Jenny. Nope, there she is. Could you give a little bit of background about ISCAN?
Okay. Yes. Sorry, I'm just trying to think my way into it. You can't upload Joan's presentation for me.
Hello.
Sorry, Candy. Okay, I'll just start. If I could just speak a little bit more generally about
Hold on.
ISCAN. ISCAN, as I just said at the beginning of my presentation, was set up by Dr. Henry Kemp, and we became official in 1977. It is the only multidisciplinary professional organisation dealing with child abuse and neglect internationally, and this is something that we are very proud of, and in particular proud because Henry Kemp believed passionately in the importance of disciplines working together collaboratively, and also of people working together collaboratively at an international level. Right, I have Joan's presentation up, so I'll see if I can follow that. So I've talked to the first slide in relation to our history, and in particular our mission to support parents and organisations working together to prevent all forms of abuse and neglect. Our objectives are set out very clearly on ISCAN's website, but essentially we are very keen to share good practice across the globe and to make sure that we are always facilitating people being kept up to date with developments, as well as encouraging people to share their research and practice findings, in particular at regional conferences and at our biennial congress. As I said, the next congress we're having is in Calgary, being held in August 2016. There are a number of different benefits of becoming a member, which include subscription to our international journal, Child Abuse and Neglect. And interestingly, I think in all our presentations we've drawn on some articles which have been published there. It's free online back to 1977 for those who are members. A link newsletter, which I think is very useful to kind of help people keep up to date with what's going on. And clearly being a member is advantageous if you want to attend any of our events. Specifically looking at the Denver Thinking Space, it was conceived as a kind of area, a virtual area to be able to bring people together to share theory, research and evidence-based practice on a particular topic and to look at it from all different perspectives to produce one document which can be used as a resource for those working in the field and also those who are making policies or legislation. And I think particularly thinking about being able to be adaptable for use of people in different cultures, different languages, and the realities of shortages of resources. This is our third Denver Thinking Space. The first looked at child sexual abuse, and then the second looked more specifically around working with men and boys as a means of preventing sexual abuse of children, because we felt that this was an extremely neglected area. Both the reports are up on our website and I think provide a hugely valuable resource for those working in the field. So now, starting this year, we are looking at positive parenting and breaking the cycle of violence against children, and important looking at how positive parenting over generations can break the cycle of interpersonal violence. So the aim of this thinking space is to prevent violence to children through supporting positive parenting, to gather your views globally on what constitutes positive parenting, so what definitions do you work to, what programs you use in your different contexts, looking at evidence that positive parenting and raising children without violence in fact does reduce interpersonal violence and other relationships and contexts, and leading to a report which will be published in time for our Congress in Calgary in August next year. So we began the process by having a workshop at the Global Institute held in San Diego in January, and then the findings from this workshop refined our concept paper and our questionnaire, which is what is being sent and available to all of you. And we are planning to have 2 webinars. We had one yesterday and the one today on the topic, and then this will be followed by a virtual internet discussion from the 25th of March through to April 1st, in which we invite you and colleagues to participate. We will then want to bring together the findings from the questionnaire and the discussions to present them at workshops to be held in our regional conferences being held this year in Toluca, Bucharest and Kuala Lumpur. And in the previous doing the thinking spaces, we found it really helpful to take our initial findings to these conferences to discuss them with participants, and then to add to our knowledge base using snowballing technique. We did find that those personal contacts through conferences were very fruitful in really getting to understand what people were doing and some of the both challenges and also the success stories. And so again, just to invite you to contribute, obviously in terms of beginning the contribution through your attendance at this webinar, to be able to further it by completing our questionnaire, and if you have other colleagues, to be able to ask them to do the questionnaire as well. Very happy for you to share it with anybody, both within your own country or if you've got colleagues working in other countries, to be able to do that. And just to finally finish, to say that there is a growing body of knowledge that building skills for positive parenting protects children within the family system from violence, and that there's evidence that building skills for positive parents may break the cycle of interpersonal violence across generations. Now, Joan's presentation goes on to talk about the importance that Marta Santos Payos, UN Special Representative, gives to this topic. I won't read you the quote, but you can see it in the slide presentation. And also that the Adverse Childhood Experiences studies have concluded that abuse and neglect during childhood may have long-lasting and severe impacts on both childhood and adult functioning. So we are wanting to keep our focus on prevention of violence against children, taking, as I said, a public health approach, looking at primary, secondary and tertiary levels of prevention, and thinking about what we can do at all levels. Having that in the context of Article 19 and in particular the General Comment 13, the UNCRC, and also of the World Study on Violence Against Children. UNICEF have very recently put out a document on ending violence against children. I've got 6 strategies for action. It's published last year, so refer you to that. And we're very keen to think about what you mean by positive optimal parenting. Is it an attitude towards child rearing, behavioural management approaches and methods, ban on corporal punishment? All of the above and much more is what Joan would say if she was doing the presenting. So I would urge you to think about the work that we have been talking about today and to contribute to ensuring that we can provide a safe home for children, this being the context in which learning for children takes place, and that we can truly move through positive parenting to break the cycle of violence against children across generations. So that is a very brief brief presentation of what Joan might have said if she was able to speak to you, but I know that her presentation was recorded from yesterday and therefore you will be able to see it in its entirety, and she will have done full justice to it. I'm very sorry that I've kind of rushed through